So on the math packet, it's going to ask you to figure their protein needs several different ways. You use the RDA on the front, or you can also use their weight in kilograms. And I put that in there just so we can compare the protein needs based on weight versus the RDA using height. All right, so back to our PowerPoint. Iron needs, you all know, are increasing during adolescence, in particular with females related to menstruation. But we also see an increase or an uptick in males due to increased protein needs and leaner body mass. This is the deficiency that's most prevalent among teenage girls. And interestingly, we see a decrease in test scores for female adolescents after they begin menstruation. And the link is thought to be related to those iron losses with monthly menstruation. You can look on page 329 for more information on iron deficiency and needs, and then obviously food sources, which you're all familiar with. Calcium, that's critical for developing dense bones, and teen girls are most vulnerable to lower calcium intakes. When we have less dense bones, that puts the adolescents at greater risk for fracture as an adult. Food choices and health habits for adolescents, they are affected by busy schedules. Oh, wait, not anymore. They're all home trying to beat each other up and eat all the food. Oh, okay, back to the lecture. But we want to stress getting a balanced diet. Adults are serving as gatekeepers, so when you're working with patients, you want to make sure that as parents of adolescents that they have healthy food available. And one of the big things is just having this food prepared and ready to go. So we've talked before about having fresh fruits and vegetables cut up so that they can grab it. Okay, an adolescent is pretty unlikely to open the crisper drawer, pull out a peck of celery, wash it, chop it up, put it in a Tupperware, and put it back in the refrigerator for snacks. So, as a gatekeeper, parents, guardians, they can make sure that they have that healthy food available for them to grab and go. Beverages, we have some more independence here with adolescents, so we're looking at soft drink consumption, Dunkin' Donuts, Starbucks, and we get a lot more caffeine and we get a lot more sugar. So that can affect overall diet consumption and increase risk for obesity. If you want to look at Appendix A3, you'll see the caffeine content of certain items that adolescents are likely to choose. Recommended caffeine for kids and adolescents category is less than 100 milligrams, which would be about 3 sodas a day. But really, I want you to picture the largest size Starbucks and how much caffeine and how much sugar they're getting. So I also linked in Blackboard video on energy drinks in teens. So if you want to look at that, you can view that. So teens have irregular eating habits. Only a third of teens are eating evening meals at home. This is during non-COVID time frame, obviously. Hopefully, they're eating meals at home now. And again, here's just those tips that we talked about: nutritious, easy to grab foods. Diets of teenage girls. Next week, we'll talk about eating disorders. And I'm not saying that only teen girls are falling into this category, because we can definitely see males in this category and older women as well. But with teenage girls, because of the fat deposits and the really huge difference in body sizes and timing of adolescence, we're comparing our bodies to our peers at an increased rate here. So adoption of fad diet, desire of social acceptance, and certainly this is magnified with things like TikTok and Snapchat and Instagram. 44% of adolescent girls are trying to lose weight, and then they're trying to lose weight, but their diets are so low in those vital nutrients. If kids are in a family that has a high incidence of obesity, they're at greater risk for